Good afternoon, everyone. Welcome to today's webinar, Breaking the Silence, Hearing Loss, Mental Health, and Substance Use. We're going to give everyone just about a minute to get in and get settled and comfortable, and then we will get started. Okay, let's get started, everyone. Thank you so much for joining us today. Again, today's webinar is Breaking the Silence. Welcome, Hearing Loss, Mental Health, and Substance Use. Thanks for joining us. My name's Robin Gardner. I'll be your host today. I'm going to start off by giving you some tech tips. To turn your captions on, you're going to click the CC icon at the bottom of your screen and click on Show Subtitles. You can increase the font size of the captions by, again, clicking on the icon and clicking Subtitle Settings. We're going to use the Q&A icon to ask any questions throughout this webinar. We're going to use these to facilitate everything after the presentation. Make sure you adjust your view to be side-by-side mode. There should be a shared screen with the presentation slides on the left. The speakers will appear on the right in a gallery view. You can adjust the size of your side-by-side view by hovering your cursor between those two shared screens and clicking and sliding that to your adjusted view, your desired view. Just a quick disclaimer that HLAA believes that information about products and services that could benefit people with hearing loss should be made available to our consumers to make informed decisions. References to any products or services or organizations does not constitute any kind of endorsement or recommendation or favoring by HLAA, nor does exclusions suggest any disapproval. I'm going to stop sharing my screen. And I am going to turn it over to our panelists, Dr. Kristel Scoresby and Michelle Niehaus.
Hello, everyone. It is such a pleasure to be here with you today. My name is Michelle Niehaus, and I am the Program Administrator for Deaf and Hard of Hearing Services at the Kentucky Department for Behavioral Health, Developmental, and Intellectual Disabilities. And what that really means is that I get to spend my time thinking about how to make access better for behavioral health services for folks who are deaf, hard of hearing, deaf-blind, or deaf-disabled across the state of Kentucky. We are going to start off actually by putting a question on you. So we're going to start off with a poll just to see who we have in our room today. So if you could share that first slide, that would be fantastic.
Do we see that?
Yes. So we
Oh,
are generally asking, why are you here today? And we're going to give you just a couple minutes to answer that. It looks like we are in great company today because Dr. Scoresby and I also think that we should talk more about these issues and we want to learn how to do it better. Sometimes people think that mental health is something to be ashamed of, and we know that it's not. We want this to become an easy conversation to have. We also truly believe in the importance of understanding how hearing loss can affect mental health and can affect substance use. So, in our time together today, we'll be talking more about that. We'll also be giving you some tips on challenges and what to do if you are struggling or if you know someone else who might be struggling. So hopefully our time together will be well spent today. Here are the results that we saw. Think you may be seeing those.
does everyone
Just
see the results?
okay. So as we have our time, and I'm just a little bit more about who I am. I work with the Department for Behavioral Health. When I'm not doing that, I am a mom, I am a wife, I'm a daughter, a friend. I love to travel, just got back from Ireland. I love to read, go to museums, volunteer, advocate, and I'm constantly learning. One of my favorite people to learn from and learn with is Dr. Kristel Scoresby. So, Dr. Scoresby, could you go ahead and introduce yourself, please?
Absolutely. I'm so happy to be here with all of you. Thank you, Michelle, for that introduction, and thank you to HLAA for inviting us to present. So I currently am an assistant professor in the College of Social Work at the University of Kentucky. I'm a licensed clinical social worker. I research mental health and hearing loss, and I'm a person with hearing loss. So I began losing my hearing at the age of 4 from genetics, those lovely genetics. um, and lost very gradually throughout my life until actually it was pregnancy, that the hormones from pregnancy that destroyed the rest of my hearing overnight. So my entire life experience is one of hearing loss. I got a cochlear implant about 14 years ago now, and am bimodal. So I have a cochlear implant and a hearing aid, which just captures some enough environmental sounds that it helps balance out the high frequency of the cochlear implant. So I'm very grateful for the technology that allows me to participate in the hearing world and have wonderful partnerships in the work that I do, including with Michelle and her department. I also parent children with hearing loss. Again, those dang genetics. So 2 of my 3 children have hearing loss, and you'll hear a little bit about my kids in our presentation today. I'm thrilled that you participated in that poll and indicated your interest in this topic, all the way from you want to learn more to you have loved ones who experience this, or even that you think we need to talk about it more, because I agree. We need to talk about it more. So we're excited to present this today. And Michelle's going to be advancing the slides for me. So, oh, we've got another learning check. I forgot about this one. So another poll is going to come up. We're going to have this poll at the beginning of and at the end. So we would love to know how you would rate your own understanding of the relationship between hearing loss and mental health, with 1 meaning low and 5 meaning high. If you wouldn't mind clicking on a number now. Has about everybody had the chance to do that yet? Okay. I don't know if we're looking at the results for that one right now. Oh, there we go. Okay. Thank you for showing those results. Okay, so we're a little bit all over the place. We're balanced with between each of these. Thank you for completing that. That helps us to know where you're at. And again, we're going to be doing that same thing at the end. All right, next slide. Okay. Now let's talk about one of my very favorite topics, hearing loss and mental health. So hearing loss is not just about the fact that we don't always have access to sound, or we don't always have access to communication, or we don't always have access to information. There's many, many different aspects that come along with hearing loss. It literally affects every area of our life. So we feel exhausted in trying to hear. We get frustrated. I have to go into a room intentionally early before a meeting starts or a class starts or something to know, where do I need to sit to make sure that I'm going to hear the best? Where is the speaker going to talk from? What are the acoustics like in this room? I have to put in effort to communicating. And when I have barriers to communicating, I get frustrated. It's very common to feel frustrated. It's common for others to be impatient with us when we're trying to understand what's going on. That's frustrating too. It's easy to isolate. It's really easy to feel anxious in a listening situation. So why are these things so common? What are we struggling with? Yeah, thank you for that slide. So let's talk about the why. Michelle, this is when you're gonna have to do all the bullet points. Sorry. So listening fatigue contributes to all of those things mentioned in the previous slide. Listening fatigue is the exhaustion that we feel from concentrated effort when our brain is spending so much time and energy focusing and filling in the blanks and trying to understand what's going on. When we spend that much effort listening, we not only feel tired, but sometimes we get headaches and feel irritable and withdrawal because our brain is tired from listening. Cognitive load is our brain's power in these listening environments. So, that's when there's missing words, when we're getting every other word or the beginning of a word or the end of a word, but not those complete sentences, our brain is working really hard on decoding the incomplete auditory signals that are coming our way. And we have to fill in these missing words and sometimes even switching between speakers. For my cochlear implant, if I'm attending something where different speakers are presenting, then it takes me a few seconds with each switch of speaker to be able to regulate to their voice. That takes cognitive load to do that. Integrating visual cues and auditory cues, we're constantly doing that. That is all of our cognitive load. So how hard our brain is working. And of course, the harder our brain works, the more we're going to have fatigue. So those things work really closely together. And the connections that we feel with our people or with the community at large, the social effort that it takes. Yesterday, I was in a luncheon on campus for end of the semester activity in a mentorship program that I participate in. And we all know lunch with groups is not fantastic, but I did want to connect and be there with the people that I've been working with all year. But the amount of effort I put into that social experience drained me for the rest of the day. So it's really normal for those of us with hearing loss to feel stressed, to feel anxiety, to feel depression, to feel irritated, to grieve. It's common for us to grieve. As I was losing more hearing throughout my life, I would grieve. Again, I would go through different grief cycles, and then I would adapt and adjust to my current level of hearing loss, and then I'd have another drop of hearing, and I would need to go through that grief all over again. But I tell you what, one of the biggest things that struck me so hard and kept me grieving longer was discovering that my children have my hearing loss. That was a whole different grief cycle that I went through and still navigate. The withdrawal of our people, of social situations. We can withdraw. We want to withdraw pretty frequently. And then, of course, we have all of our other life stressors that don't have anything to do with hearing loss. Illness in our family, children, trying to raise children and take care of aging parents. We have financial issues, and right now especially, finances are so hard. So we have all of these other life stressors we have going on. But so this is all of these stressors I've been referring to and talking about leads to this research I'm about to share, that those of us with hearing loss are two times more likely to experience depression and anxiety than those who do not have hearing loss. And we are more likely to use antidepressant or anti-anxiety medications based on all of the things that we just talked about. That is our mental health, folks. Our hearing loss affects depression. Our hearing loss affects anxiety. And depression and anxiety also affect hearing loss. This is one of the ways I love to explain some of the differences of how we can know if it's mental health as just a day-to-day issue or problem, or if it's an actual mental health disorder. So at the bottom of this pyramid, you see the no distress, problem, or disorder. This is kind of like you had a rough day, you had a rough moment, but it doesn't linger to bad stress. You can work through it, you're okay. That's at the bottom of our mental health literacy model. And we go up to mental distress, that our rough day impacts us. Maybe we lose a little bit of sleep. Maybe we overeat, or starve ourselves, undereat, because we're stressed. But it's temporary. It doesn't last very long. But then we go up to this mental health problem where it's starting to last longer, the distress that we're feeling. It's starting to create more and more isolation within us. It's starting to affect the way that we talk to ourselves, the narrative that we have in our mind, and becoming more critical of ourselves and affecting our self-esteem. So it becomes a mental health problem when it starts to stick with us more. But then what about mental health disorder? This is when the things that we're trying to do to cope aren't enough necessarily. And that the symptoms that we feel, the not sleeping well, or being really hard on ourselves, or the anxiety that we feel, when it's lasting for longer and is affecting our relationships, then it can become a mental health disorder. And please don't hear me say that hearing loss is the only thing that's causing mental health disorder. There are many mental health disorders. This is just one of the relationships that we have with mental health, is with hearing loss. But there are other mental health disorders we might already be struggling with that don't have anything to do with hearing loss, but hearing loss can worsen some of those symptoms. So let me just run a quick example through here. So I told you that 2 of my children have my hearing loss. So my son is my middle child. He's almost 17. He plays soccer for our local high school. He loves soccer. He loves band. He's very big into his activities and the things that he's doing. He's very active and involved. And one of the hardest things for me as a parent is seeing him on the soccer field, seeing him not hear his coach or the ref or other players. And he just kind of freezes on the field, in which he doesn't know what someone's telling him when everyone's giving him information. It's too much auditory information, and he can't hear it and process it enough to know what he's supposed to do. One time a game stopped because he was not understanding what was going on the field. And what was happening is he was being subbed out. And so he was supposed to be walking off the field, but normally he has a visual cue. So the kid with a jersey that comes and hands them to the jersey, and then he walks off. But that didn't happen this time. There was no visual cue. So he wasn't understanding that he was supposed to get off the field. And the game stopped until he came off of the field. Watching that was so hard for me. So I was definitely feeling some distress. But my son was also feeling some stress, because how awkward is that? How vulnerable is he? How embarrassing that he wasn't picking up enough of the cues to understand. But what if he took that experience and then he didn't play his next game, or interact with his soccer teammates, or interact with his coach? And then what if he took it to the next level and he quit soccer, and he stopped doing the things that he wanted to do and the things that he cared about and that he was interested in? And he ruminated over that event, or a series of events that occurred over and over, so that it was affecting his sleep. So as those symptoms increase, as the duration increases, as the severity increases, that's what this mental health literacy model describes, so that eventually he might need to get more professional help if that were to be the case. Next slide. So here's another list here of when is mental health a problem for us. So maybe when that stress or anxiety or irritability or depression is affecting our relationships, that means it's a problem. When we are avoiding the things or people that we do enjoy, that's a problem. If we feel stuck, overwhelmed, hopeless, and it's not getting better with small changes, it's not getting better with just trying to suck it up and have a good day and get over it. If those things are not getting better, you know mental health is more of a problem. Next slide. But when it's a problem and we need to get help, it's hard to get help. Why? Here's some of the reasons. There's actually a lot of stigma still. There's stigma with mental health. Every day, this is what I'm facing as a professional, is that we have to continually help people realize mental health is just as important as our physical health. And going to a professional for mental health is just as great as going to a professional for our physical health. So there's a lot of stigma, and we think that with emotional issues and mental health issues that we should just be able to handle it. We should just have the skills. We should just get over it. We should just be able to handle it. And society still continues to see that mental health issues are a personal weakness on our behalf. So Michelle and I are working really hard to be able to help fight the stigma that getting help is actually really, really necessary in several instances. And it's a good thing to do. It's not a personal weakness. It's a good thing. So sometimes people think that, it's just normal. All my experiences in life, my symptoms in life, it's just normal. And it just becomes part of who we are, withdrawing all the time, frustrating all the time, feeling anxious, avoiding social situations just becomes normal. And so we don't need help because it's just normal for us. But that's not actually true. We do want help. We do want to work past that because life is worth engaging in. There can be communication barriers. Let's say you can get past the stigma, get past the struggle, and you go to treatment and your therapist doesn't know how to communicate with somebody who has hearing loss. And they're, turning around and writing on the board or looking down as they're writing notes instead of facing you, so that you can see their visual cues on their face. So there can be barriers in treatment, and that means it's not accessible and it can be exhausting. There's also this fear of not being understood, or this fear of all you'll see me is of someone with hearing loss. There's so much more to me than that. There's also this lack of integration between hearing healthcare and mental health care. And this is a specific area I research, is trying to integrate these models so that when we go see our audiologists or our ENTs or our speech language pathologists, that we're able to address our mental health care within the hearing healthcare system. That's my dream. That's what I'm working on, so that it's not an outside system, because often, those hearing healthcare professionals, as they see in us that we have a mental health need that needs to be addressed, oftentimes it's by referral. Call this person. How many of us want to make a phone call with hearing loss? Well, it's now much better with Bluetooth streaming. It's much better, but that doesn't mean we love the phone and want to call folks. So these things affect us and our ability to get help. So we do develop a lot of coping skills. Sometimes our coping skills are great and they're helpful. Sometimes they're not. One of the ways that it's not helpful is to use substance abuse, it's to use substances to navigate the struggles of all of the things that we are facing. And it is, youth and adults with hearing loss are more likely to have substance use disorders than folks who are hearing. Isn't that crazy? That we are more likely to have substance use disorders. But why? That isolation, that fatigue, sometimes being harmed by others because of our being left out, or the jobs insecurity and not being able to be seen as competent in the work that we do, all of those kinds of things that go along with hearing loss. can make us more susceptible to using substances. So we can turn to self-medicating for that reason. And sometimes there's communication barriers in care where, for example, somebody does receive a pain medication for a condition, car accident, for example, broken leg, but the the person receiving the medication doesn't understand the instructions in taking the medication. Something like that can also contribute to substance use issues. So these are things we have to pay attention to and address so that we do not increase our own risk of utilizing substances to cope. So increasing our mental health literacy matters. We want everyone in this room, we want you to experience an increase in mental health literacy. We want you to know what it is. We want you to learn about the whys behind our hard moments, how it's affecting you, why it's affecting you the way that it is. You know, we want to understand that stress and isolation, yes, it is part of the process. And just because I feel stressed, just because I feel isolated, doesn't necessarily mean I need to go get help. But when it becomes a trend in my life, and if I'm avoiding the things that I love, it's time for me to go get some help. And we want to build our helpful coping skills. And we want to also advocate for treatment access to make sure that those mental health providers are aware, are competent, are increasing their knowledge of working with people with hearing loss. And that takes advocacy from all of us. So increasing our mental health literacy is really, really necessary for those of us with hearing loss. And it's possible. We can do it. It's manageable. We can do it. Just simply coming to a webinar like this and participating in other ways to increase your literacy is really important. So now I'm so excited to turn the time over to my partner, Michelle. We are doing so much good work, you all. I wish we had time to talk about more, but Michelle, go for it.
Thank you so much, Dr. Scoresby. When I think about all that you've shared already, I think about how interrelated mental health, substance use, and hearing loss can be, even to the point that somebody put in the Q&A or in the chat earlier, some medications actually can cause hearing loss. So one way we've made progress is actually through our opioid response effort. Interestingly, because opioids can cause hearing loss, but now there's funding to address opioid use across the country. So we've developed peer support to help support those who have lived experience of mental health, substance use, and hearing loss together. So one of the things that I think is really critical to start with is remembering that we are not alone. Connecting with others who have shared experiences really can make a difference. I am a big fan of psychologist Dr. Michael Harvey. He has several books that I think are really helpful to consider when he looks more at those emotional and social aspects of hearing loss, because connecting with others who have shared experiences really does help. The Kentuckiana chapter actually read this book together, Listen with the Heart, Relationships and Hearing Loss, to talk about it. Because sometimes it's hard to admit, I really have a difficult time at a family gathering, or I really have a difficult time connecting with my spouse or my partner. So we ask you to consider discussing the emotional aspects of hearing loss at chapter meetings. Encourage support groups for newly identified individuals, maybe in partnership with an audiologist's office or a mental health center. I was able to attend a recent HLAA meeting, and one gentleman drove all the way from Lexington because he wanted to meet one other person who had hearing loss. And I was supposed to be lecturing, but it turned real quickly into all those members supporting that person. And that's exactly what should happen, is that people who know and who have walked that walk can help support each other through that time. We are currently in Mental Health Awareness Month, and there are organizations there who can help. Mental Health America offers a toolkit with affirmations, journal prompts, and worksheets. You can also do online mental health screenings, and you can get information about caring for your whole self. As Dr. Scoresby said, there's a mental aspect, there's a physical aspect, there's an emotional aspect. We're all connected. And so there are things you can reach out for on the Mental Health America national website to get more information. Your states are probably doing awareness events all over this month. Plug into one. Connect with somebody who might think, oh, we never actually considered having captioning at this event, or, oh, we never actually thought about hearing loss and mental health together. It can be a really good opportunity. They also have a mental health learning hub, an encouragement to find the right path for you. For some people, that medication might be the best route. For some people, it's therapy. It might be individual, it might be group, it might be going to one of your faith centers. There's no wrong path to getting help. The point is to figure out if you need help and to reach out so that you can find that path that works for you. There are other resources for learning more about mental health and mental wellness. Each state has community mental health centers, and these are places where a person can go who has private insurance, but also people who have Medicaid or Medicare, Medicaid and Medicare. They can get individual counseling, sometimes family counseling. So those local community mental health centers are often hubs for both treatment and prevention. So you can find out where your local community mental health centers are. Your state also will have a mental health authority, like the Department for Behavioral Health, Developmental, and Intellectual Disabilities. They have long names that make it really hard to find, but the goal is to find what it's called in your state and to connect. And some states even have advisory committees. I got to meet Dr. Scoresby through our advisory committee. So we have 16 people who are deaf, hard of hearing, or state agency representatives, sometimes both, who can come together and say, this is what we really need. How can we build better access and quality of services together? There are also organizations called the National Alliance on Mental Illness, or NAMI. It's another great place to plug in. They often have support groups, and that can be a place to learn more. And their websites also have information about common diagnoses. Kind of back to that idea of we're more than one thing. You're more than your hearing loss. You're more than whatever emotions you're feeling right now. We have one body and one mind, but it's all connected. Sometimes our emotional well-being will affect our physical well-being, and our bodies might show us that something is off. I'm thinking about people who are never ever going to say, I'm really depressed, but they might feel really heavy in their body. Or they may never say, I'm anxious. They may not have the words for that, but they have constant headaches. Or the shoulder and the neck is often really, really tight. Or stomach aches are recurring. Sometimes our bodies tell us what our hearts and our emotions are doing before our minds tell us. So if you're starting to feel that, or you're hearing other people describe these things, check with your physician first. They might do a mental health screening for you. They may refer you to a specialist. Sometimes a primary care physician will do some of that mental health initial counseling. They may do the prescribing, or they may send you somewhere else. You can also go to your insurance company to get referred to providers in your network. So there are ways to think about it. And sometimes if you're caring for somebody else who might be struggling, sometimes starting with these physical symptoms and asking about that can be a door because they may not be so excited to talk about how they're feeling emotionally, but they might talk about how they're feeling physically. If you're a person in crisis or you know somebody who is having a mental health crisis, you can also call 988. This is relatively new. It's about 2, 3 years old. What is really interesting is that they went from having a 1-800 number to having a 3-digit number. So just like you would call 911 for an emergency for police or fire, you can call 988 if you're having emotional problems or stress and you would like support. You don't have to be suicidal. You can just be having a really hard moment and you need some support. Or you might need to be referring somebody else to that and you're not sure where to go. Not only can you use the phone, or you could use something like your voice carryover phone or caption call, you can also text and you can chat. And for video phone users, there's also a video phone line that's answered directly by people who use sign language. So they will also help you find the right path for you. It might be a psychologist, it might be a social worker, a psychiatrist who can prescribe. It might be individual counseling or therapy, group counseling, family therapy, private mental health, community mental health. There's no wrong door. And it may be a few things that you try to figure out what that right path is for you or for the person you're caring about who has some mental health challenges. Dr. Scoresby talked about the barriers to access, and those are true. What I've noticed in my practice is that sometimes people who sign have an easier time explaining what they need than people who don't sign, because a provider might say, oh, an interpreter, I can do that. But if you don't use an interpreter, or if a person uses listening and spoken language, it's more common that a person's going to overestimate how much a person is hearing or understanding if somebody has a unilateral loss or a bilateral loss. It's often hard too for a person with hearing loss to say, I don't hear well, and this is what I need. So one thing I love, one of the many things I love about Hearing Loss Association of America is the Communication Access Plan project. During COVID, I think it was, they started a communication access and healthcare program. Um, because we know that communication connects, miscommunication disconnects, and a lack of connection isolates. We want to make sure that communication access is clear if a person is asking for help. And the communication access plan is a way to have a dialogue between you and your provider. There's an example of it online at the national office, and you can just take this with you and you can say, I identify as hard of hearing. I have a hearing aid in my right ear. I have a cochlear implant in my left, and I need you to provide these things to make access. In Kentucky, we are actually making this something in our community mental health centers to help people have those conversations because we know that effective communication is essential to effective behavioral health treatment. So, as you think about how to self-advocate and you think about what you can do at your chapter level, you could think about, is that CAP something you could practice with in your chapter? Is it something you could take to a local community mental health center? Is it something you could advocate for in your state? We want to make sure that it's everyone's responsibility for effective communication, not just the therapist, not just the patient, but everyone. You may be thinking also about how to help other people. You can actually call that 988 number on behalf of someone else and ask for ideas of what to do or how to start that conversation. Sometimes you can just do the simple things you probably already do. Check in with those you love. A simple text or call can show that you care. And there's research that shows that compassionate contacts can help a person to feel more connected and to have less to spare. If you're trying to support someone, you can offer to go to that first appointment. It can be scary to walk into a psychiatrist appointment or a therapist appointment the first time. But if you offer to go with somebody, that might just be that nudge to help them get in that door. It's also okay to not be okay. Sometimes you get that positive psychology that says good vibes only. If we only do good vibes, then we're not talking about the reality of the lives we're living, and that can make it difficult. So if we are more honest with each other and then work together to figure out how to have those more good days, that's going to be more effective for everyone than pretending like everything is okay all the time. We've talked a little bit about mental, physical, social things. We've talked about the emotional. And we've talked a little bit about coping strategies. This is a wise group, I'm guessing, on this call. And it looks like chat may actually be working. Um, so either pause and think, or if you can enter in the chat some ideas for what strategies you do. Just like we have mental health challenges that are mental, physical, social, and emotional, so too are the coping strategies we use. So, for example, mentally, I know a lot of people who do Wordle every day. That's one of those simple, like, be connected. My husband does it and he competes with his siblings. They're in their 50s, but they still have to compete. I don't get it. But figure out what those things are that help your mind stay strong. Physically, it's beautiful here today in Kentucky. It's a beautiful spring day. Who goes for a walk to help with their physical things? Socially, where do you connect? Are you part of a local HLAA chapter? Do you have a book club you go to? Are you part of a faith community? What are those social things you do? And emotional, are you a journaler? Do you talk to a best friend? Do you have a chat group? So think for a second what your go-to strategies already are for healthy coping. What we want to do is break the silence around mental health challenges. We want to connect with the community for awareness and for healing. So as you think about those individual strategies, you can also think about community strategies. You could invite mental health practitioners to a local HLAA meeting to learn more. You could publish information about Mental Health Awareness Month, Recovery Awareness Month, or other awareness months in your chapter newsletters. Make it normal that we talk about those things. This week, or this month, it's Better Speech and Hearing Month, Hearing, Language, and Speech Month. Um, September, we have Recovery Awareness Month. Those are great opportunities to elevate the conversation and open the opportunities for discussion. You could also think about sponsoring depression or anxiety screenings during meetings, during your walk for hearing, or in partnership with local health agencies like Mental Health America or the National Alliance on Mental Illness. And attend local health fairs so that mental health providers think about the connections to hearing loss and those implications for access. We covered a lot of information, and we want to see how we did before we jump into question and answer time. And then we also see that there are already some questions in the chat, and you can feel free to put those in there. So we are asking you to rate your understanding of the relationship between hearing loss and mental health. Fantastic. It looks like we are getting 5s and 4s. We've got about 63% who have participated. I'm going to go ahead and end the poll and share our results. I love the fact that this is an excellent beginning of the conversation. There is no way the two of us can talk about all the things we want to talk about in an hour or 40 minutes or wherever we're at this point. So I think we can go ahead and jump to some of the Q&A. Dr. Scoresby, was there anything you wanted to add to the information dump that I just did?
One of the things I wanted to do, because I have been following the questions and responding to some of them, but some of them I know we want to talk about together. But one of the things I want to emphasize is the advocacy efforts are so very important for our own mental health needs. And because not all of the therapists, not all of the professionals in mental health have been trained in working with those with hearing loss, that using something like that communication access plan can be really helpful in elevating the awareness and elevating the need. But Michelle, you've done some webinars and some trainings for some mental health professionals in Kentucky. Are any of those open access where we can share with some of our participants so that they can share those links with maybe the therapist they want to work with or a case manager they want to work with?
Sure. We do have a YouTube channel for our department, for our Deaf and Hard of Hearing Services program. When Robin sends out the follow-up information to the webinar, we can certainly send the link to the YouTube channel. Because I think that education is really important. Honestly, though, I don't know how much a provider would watch a video from a stranger. Sometimes having the willingness to have a basic conversation with folks and then to try to find those local solutions can be really helpful. Making those personal connections might help too.
Yeah, one of the questions I wanted to address here is about, when we don't have access to a provider who knows how to work with the deaf and hard of hearing, if we feel pretty stuck. So this person's from California. California is actually where I grew up. So hello, fellow Californian. That there can be limited resources. And this is where some of your advocacy efforts are going to make a difference. So there are providers who maybe are not going to take the time to learn about communicating with a person with hearing loss or what they need to do differently in their office or on their telehealth to accommodate that person. If that's the case, kick them to the curb. That's not the kind of mental health professional you want to work with, right? But if it's somebody who maybe doesn't have the experience in working with clients with hearing loss, but they're open and willing to be educated, maybe sharing a couple of resources, or like Michelle said, having a conversation about what's needed. And then they should go do some work on their own, because as a person with hearing loss, I know it's my job to educate, but to a point. At some point, I need the other person to run with it, to learn, to go from it, because I shouldn't be the one educating all the time, especially if I'm the one who's being served or I'm paying for services. That individual, that professional, should be doing some work on my behalf too. One of the things that we'll share in our follow-up email is I have a checklist I created of working with a mental health professional. So I call it the therapy office accommodations list, where there's a list of things that you might need. And you can circle or check the ones that you need and hand it to that therapist and let them know, this is what I need. I need you to not sit in front of the window where this light is coming in behind you so I can't see your face. I need you to look at me when you're talking and not to look down. I need you to give me a handout to help me to have some visual information of what we're talking about, not just verbal. It's a list of accommodations, and you can check the ones you need, you can add to it. So I'm happy to send that out for folks also, so they can use that as a resource. Anything you want to add to that one, Michelle?
Oh, I just love that you have already developed a therapy accommodation checklist and that it is ready. And I think it's a really good point that it shouldn't always be on the responsibility on the person with hearing loss to make those accommodations. You shouldn't have to ask for help and teach the person about hearing loss. So we want to absolutely avoid that. I can also share a link to a training that Minnesota created online that's specifically around hearing loss and therapy. And it's for providers, so we can provide that resource as well. And we do hope that this is part of the ongoing conversation. Both of us will be at the national convention in Louisville. So for those of you who are coming, we'd love to meet you in person. And we did put our email addresses as well on the slide. I'm going to get to the end. Somebody had a request that we stop the share as soon as we could. Just a few of our references. And I'm going to stop the share so you can see us a little bit bigger. And it looks like we have lots of questions in there. Oh, here's one that might get a little bit personal. My child is transitioning to college. Another kid has just graduated. What can I do to equip them as they start adulting to help with good mental health for people transitioning from high school into college? Is that one you would like to answer, Dr. Scoresby, or would you like me to start?
Go for it.
I think that you've probably already laid a great foundation for them. You've probably already been working on a lot of those skills through their whole life. Um, Maintaining the fact that you're there as a resource for that person, for your children when they leave, and that you're there to help if they need it. Letting them know where their resources are if they're going to a campus, if there is a mental health counseling center, or if there are options there for them to turn to. But just helping them be assured that it's a natural transition. It can be challenging. Um, that's part of life, but also you're there for them the same way that you have been before, and that you have confidence they're going to figure it out. Going in with the expectation that they'll do well, and then equipping them in case they do have struggles. What would you add to that, Dr. Scoresby?
Well, I'm in a similar position. My daughter is graduating from high school this year, and about to leave home. So bittersweet. Um, but we actually like do role play scenarios where we're like, okay, you come across this situation and you're really stressed about it or you're really anxious about it. Like, what do you do? So we talk it through, because I want her to have some pre-selected options for when she comes across different scenarios. And she and I want her to have kind of like this list of skill sets that she starts with as she's on her own. And so she has like a favorite breathing activity to help her with mindfulness that I've taught her. And I want her to access her resources. So I want her to use campus resources, whether it's a disability office, whether it's a counseling clinic, whether it's a tutoring. I want her to access the resources she has available. So that's another thing we do.
And Dr. Scoresby, to piggyback on that conversation that you're continuing to have with your daughter, one of the questions we've got were some ideas for conversation starters to talk to your teen or your tween about mental health and the anxieties and relative to hearing loss. Any ideas or tips we can share?
Yeah, a couple. So I will ask my boys, my daughter does not have hearing loss, my boys do. So some of the things I will ask them is, what did you hear really well today? You know, or which of your friends is patient when you're struggling to hear them? Or which friend will help you access a conversation if you're struggling? Which friend of that do you kind of rely on to help you to hear? And then the opposite questions, like what teacher is difficult to hear, and where are you sitting in the classroom with that? Or is there a friend or an acquaintance at school who puts you down or who notices your hearing aids and makes dumb comments about it? So I normalize that because I have hearing loss too. So I talk about my own experiences, but and also just it's really hard. We have really hard hearing days. And so I'll say, today's a hard hearing day. Is it a good hearing day for you, or is it a hard hearing day for you?
Great, thank you. And just an aside, our HLAA website, hearingloss.org, is about to launch a new wonderful section to our toolkit, which includes some great conversation starters between parents and children with hearing loss. So look for that, everybody, within the next probably week or so.
Thinking about a support group we had the opportunity to do last week, and we brought some of our peers who were people with hearing loss themselves into a middle and high school classroom. And we had about 11 students who were aged 12 through 17. And their biggest concerns were around bullying and being teased. And it was interesting because one of the students talked about her own family and how they treated her. And then she talked about the chosen family she had at that school. And so I think the importance also of making sure people have connection to at least one person who they can trust and who they can talk to is really important for the adolescents and young adults. I am seeing lots of resources you all are sharing with each other in the chat about different places to go and different technology to use. Um, We did not talk about the deaf community specifically in this workshop, but there are organizations that do counseling, Deaf Counseling Center, National Deaf Counseling. They all do telehealth, and that is available nationwide. Sometimes it's dependent on the state and what the rules are for that state as far as telehealth or the kind of insurance a person has. So that can be a challenge. But I would certainly look at those resources. There are also great resources online as far as there's a deaf mental health hub now, and there are videos that are being shared through social media, through Facebook, and through Instagram. And we did focus more on people who identify with hearing loss and who don't sign on today's conversation. But we know that those individualized needs vary, and they may vary for a person over time. So I think part of the process folks have too is figuring out what's that fit. What's that fit for the kind of therapist, the kind of language, the modality of communication, and being open to trying and seeking the person that's going to be the best fit for you, like Dr. Scoresby said.
There was one other question in the chat. What does it mean to sponsor a depression or anxiety screening? Can you briefly elaborate on that or maybe clarify that?
Sure. So organizations like the National Alliance on Mental Illness and Mental Health America have screenings of like 10 to 20 questions, and they can come and they can help do that. You can also do that online to kind of get a sense of if you might be showing some of the signs or symptoms of depression, anxiety, post-traumatic stress disorder. Um, Sometimes having somebody from those organizations come and speak to a chapter can help, but we also can get into that challenge of getting online and digging in and doing a lot of research on your own and going down a rabbit hole without talking to a professional. So we would just encourage you to think about if you do a screening and it does show that there's an issue of concern, going back to a professional and following up that way.
Great, thank you. And I think we have time for one more question to be answered, or just an overarching message that you think encapsulates everything you're talking about. I think community would be tops on that list, and finding your community and finding that community of support. Is there anything else that you can kind of wrap this up with a nice bow for right now with?
Well, I would agree that community is so important, and that's one of the hardest aspects of having hearing loss, is it can be difficult to connect to our community, to find the people that will advocate for us and work with us as needed. So, and then once we find them, we hang on to them, right? But the thing is that we have to push through so much discomfort to navigate the world. We have to push through so much hearing focused materials and setup and physical environment, and we just have to push through a lot. And it's okay that we have to push through, and we need to take care of ourselves. And it's not our fault that the world is set up to be a hearing world. So understanding that that the world still needs us, even though it would be easy to isolate and pull away from the community we're seeking. Don't pull away. Keep coming, keep attending, keep participating, keep pushing through, and then definitely take care of yourself as you need.
Yeah, I'm looking at a lot of the questions and comments that we didn't get a chance to address, and this was pretty much of an overview and it was vague. Everyone has their own individualized journeys in life. And I would say keep learning, keep being open to identifying where you're at now and what supports you need to move forward. And like Dr. Scoresby said, try to get beyond the stigma. Sometimes you have that double stigma of having a hearing loss and a mental health or substance use challenge. But there is hope and there is help. And there are lots of ways people can get support. And so to take an opportunity this month to learn more about both and see what is going to help you to live the life you want and to thrive, because it is possible.
Thank you. And just a reminder for everyone to go on to hearingloss.org, to our chapter resource page, and you can find a chapter near you that can be part of that support group in your life. I want to thank you, Dr. Scoresby and Michelle, so much. And thank you, Cindy, our amazing CART provider today. Just a reminder again, this webinar was recorded and we will be posting it on our website, hearingloss.org, with the live captions included. We'll also be emailing this out to all of you who attended today with the PowerPoint slides and links to those resources that Dr. Scoresby and Michelle referenced. And we thank you all so much for joining us today, and we hope we'll see you all again soon. Be well. Bye-bye, everyone.